and welcome to our live coronavirus teletown hall meeting. And one of our guests today will be Dr. Nicole Saphier. Dr. Saphier is currently the Director of Oncologic and Breast Imaging at Memorial Sloan Kettering Monmouth, and you've probably seen her on Fox News as a medical contributor. She also has a book out now called Make America Healthy Again. And then welcome to Dr. Saphier. Dr. Saphier, thank you so much for joining us.
Absolutely. I'm happy to be a part of it.
Well, before we bring in Tom Grech and some callers, I guess we should talk a little bit about what's going on as far as the virus not in the air and wearing masks. I know the policy in New York is to wear masks. How important do you think that is going forward as to whether or not people wear masks, particularly in the New York area?
Well, you know, the New York area has been hit hardest across our entire country. And, you know, we know a lot more about the novel coronavirus that causes COVID-19 now than we did in the last week or 2 weeks or 2 months, for that matter. And the bottom line is this is a highly contagious virus. We know that it is contained within the respiratory droplets that you expel as you cough and you sneeze. There's also some data that's telling us that this may actually aerosolize, which is why it's so contagious. So it actually travels in the air, and which is why one person can infect anywhere from 7 to 10 other people just by being in close proximity to them. So because it is so highly contagious, that is why it was recommended that people wear masks, because that is the easiest way to not only prevent getting the infection, but prevent someone who's an asymptomatic carrier from infecting anybody else. And in the New York City area specifically, social distancing can be quite challenging. We have a lot of tight spaces. So if you are having to be on public transportation or be around other people, it's really best that you do continue to wear a mask until we have a proven treatment and or vaccine.
Okay, let me get back into it. Hello and welcome to our live coronavirus teletown hall meeting with Dr. Nicole Saphier and Queens Chamber of Commerce President Tom Grech will also be joining us. I am John Cummings. I'm running for Congress in New York 14 against Alexandria Ocasio-Cortez, and I'll be your moderator for this afternoon as we answer your questions about the coronavirus. Just a few quick housekeeping tips for today. We are all live, and you will be given the opportunity to talk and ask a question of either Dr. Saphier or Tom Grech. And in order to ask a question, just press 0 on your telephone keypad at any time, and one of our staff will be waiting to help you with the process. If during the town hall your question was not answered, or you have more questions or comments, there is a voicemail option at the end of the live teletown hall meeting, so stay with us and let us know how you like this format by leaving us a message. So I think we'll take a call. We're also waiting for Tom Grech to join us, and Dr. Nicole Saphier, as I mentioned, is with us. She's currently the Director of Oncologic and Breast Imaging at Memorial Sloan Kettering Monmouth, and she has a great book out called Make America Healthy Again. So we'll go to a call. Let's speak with Gloria up in the Bronx. Hi, Gloria.
Oh, yes. Hello?
Yes, hi. This is John Cummings. Do you have a question for Dr. Saphier?
Well, 2 things. I was wondering, the question was, do you have, in order to get tested for the COVID, would you have to make an appointment through your family provider?
Well, that's a great question, and the best resource, because testing centers right now are kind of very fluid, more keep popping up. So the first thing to do is absolutely call your primary care doctor and see if they are available to offer you tests. A lot of places right now are still not able to do it. However, there are a lot of drive-up places that are offering that. And so you can usually find online, possible if you can call your town hall. Whatever you have access to doing is just kind of look it up. You put in your zip code and they tell you where there are available testing centers. Another option is to call your local hospital and see if they have recommendations. But I usually would encourage people to just call their primary care doctor or any doctor that they have established care with to ask them for guidance.
All right, thanks for calling in, Gloria. You also have Lita from Queens, a question for Dr. Saphier. Lita, how are you today?
Good.
A question for Dr. Saphier.
why do people get more sick than others?
Well, that's a really good question. And, viruses can affect every person differently. I mean, some people, even with the flu, you have some people get really sick and some people just get a little bit sick and then they seem to get better. With this novel coronavirus, we're starting to see that the people who get really sick tend to be older and they have a more complicated immune system. So when the virus enters their body essentially kind of flips out a little bit and over-attacks the virus, which is actually causing them to have worse symptoms. And also people that have pre-existing conditions such as high blood pressure, diabetes, lung disease, maybe they've been cigarette smoking for a long time. They're also having difficulty fighting off the more severe symptoms of the viral infection.
Thank you, Lita. We just want to remind everyone, if you want to ask a question of Dr. Saphier and of Tom Grech, who will be joining us momentarily, just press 0, and that will connect you with some of our staff, and they will put you through, and you hopefully can get to ask Dr. Saphier or Tom a question. Let's reset here. I'm your host, John Cummings. I'm running for Congress in New York 14 against Alexandria Ocasio-Cortez. We feel that she has left kind of a void in the district as far as not having an office in the Bronx, and we'd like to try to fill that void. We're trying to make this as non-political as possible. That's why we're having this informational teletown hall today with two real good guests. Once again, Dr. Nicole Saphier and Tom Grech will be joining us momentarily. So once again, if you want to ask a question, please press 0. And Dr. Saphier, I'll ask you another question. I asked you one before. I'll ask you another one about how different it is as we move around the country. Why do you think, other than the obvious reasons of population, why do you think that this virus spread so quickly through the Bronx and Queens, where our district is located? And also, kind of to link up with your book, how important is it for us, really as a society, to be more healthy, to make better choices?
Well, those are very good questions, and unfortunately, in the New York City area, specifically where you're talking about, you have densely populated areas with multi-generational families, a lot of people congregating together, you have a large religious gatherings, you have a lot of public transportation, and commuting in and out of New York City. And so plus, in addition, you also have a large international travel population, specifically in the time of the Chinese New Year, when a lot of people were actually flying to and from mainland China. So unfortunately, I think this virus went a little undetected for a little bit, and it was already starting to spread before we had even an idea about it. And because of our society and our connectivity is why so many people actually did get the illness. But also, you have to know that they beat all of the statistical models because of the integrity of all the people doing what they needed to do. You had people social distancing, and as painful and as hard it has been, because everyone took these measures, they beat all the models, and fewer people have died than projected. And you have to say bravo to people for doing that, really working together. But that being said, chronic disease is a real problem in the United States. I mean, my book that just came out, that's all it talks about. It talks about how we as a society have become much more weakened because we unfortunately have too much chronic disease. And a lot of it has to do with our diet and our lack of exercising. But if everyone could just try and eat a little bit healthier, incorporate a little bit more fruits and vegetables and some healthier meats like fish and chicken, and lessen some of those sugars, as well as also trying to be a little bit more physically active, we would really reduce a lot of those chronic illnesses, because up to 80% of the leading cause of death, which is heart disease, up to 80% could potentially be prevented if people just led a little bit healthier of a life.
Yeah, it's such a difficult position to be in. You talked about, being not late, but it really went undetected for a while. I think so much of that had to do with the late information that we got from China. And I'm sure it really wreaked havoc on the early models, because we really don't know all the information when it comes to exactly how many people were affected overseas. And we were, in a way, I guess they were flying blind when they were making those models. Let's pick up a call from Victoria in the Bronx. Hi, Victoria. I have a question for Dr. Saphier.
Yes, hi. Can you hear me?
We certainly can, Victoria. How are you today?
I'm good, thank you. Thank you, and you have my vote come November. I promise you that. I have a question. I watch Governor Cuomo's news conferences every day, and today he said over 4,000 new people tested positive for coronavirus, but he does not give any demographics to this. I'm wondering if anyone knows, are these all essential workers who we are forcing to go to work every day, and thank God they're willing to go, or they have to financially? Are they people who have been positive, who are being retested? I have a cousin whose kid has tested positive now. It's 33 days. She happened to go 2 days ago. So this number is very scary for a city on lockdown, that 4,000 more people are testing positive every day. But I don't know who. I don't need names, but I would like to know the demographics. Is it possible to find that out?
All right, thanks, Victoria. It's a great question. Go ahead, Dr.
Victoria brings up a very valid point, and the truth is we don't actually know who's reporting these positives. It's a combination of still public people in the public. It's plus healthcare workers, plus other essential workers. The important thing is that we're having decreased hospitalizations, decreased ICU admissions, as well as the rate of new infections. We are now, I believe, like 16 days on the decline. So we have to look at it in that sense. When you're hearing about some of the new infections and the deaths, I mean, Governor Cuomo just mentioned another 306 deaths were reported. I mean, that's a devastating number. You have to know the people who are dying right now contracted the virus likely several weeks ago and have been fighting for their life ever since. So although the new infection rates are on the decline, because we're continuing to increase our testing, we're still going to keep seeing new numbers. But unfortunately, it's a double-edged sword. We can't lock everyone down in their home and not let anybody leave the house. There still is some human interaction because you still have essential workers going out. And so it is some of those essential workers who are getting infected, and perhaps they are then transmitting the infection to their families, whoever they come into contact with. The truth is we don't know because they don't actually release exactly who's being tested.
Well, it's Dr. Nicole Saphier here on our Teletown Hall. My name is John Cummings. If you'd like to get on the air, we'd ask you to, and ask a question, we'd ask you to press 0. And we have a question from Iris for Dr. Saphier. Hi, Iris. Are you there, Iris? No, I guess we lost Iris, so we'll have to get to another question. Once again, my name is John Cummings. I'm running for Congress in New York District 14 against Alexandria Ocasio-Cortez, and this is our Teletown Hall. We have Dr. Nicole Saphier with us, who is currently the Director of Oncologic and Breast Imaging at Memorial Sloan Kettering Monmouth. And we should be joined by Dr. Tom Grech in a few moments. And we have a question from Angelina in Astoria. Hi, Angelina. How are you today?
I'm fine, thank you. My question is, when you come in the house after leaving, after being outside, when you come in and you wash your hands and everything, is there any other thing that you need to do to make sure that you do not carry that virus into your house?
Okay, well, so great question. My husband and I are both physicians, so we are both still having to leave our house quite frequently, and coming into the house is a challenge that we face as well. We essentially have labeled, we pretend that we have the virus on us everywhere when we get to our house. So as soon as we get home, we try and change our clothing. If we can take a shower, great. If we can't, we wash our hands vigorously. But the best way to really protect yourself is to make sure that you are not contracting it while you're out, because although it can live on your clothing, you're more likely to get it by breathing in air that someone who is infected just left, meaning and specifically if they coughed or sneezed. So when you are out in public, by wearing a mask, you are really reducing your risk of contracting the virus. And also, I think people are a lot more aware right now of how much they touch their face, because your hands are that is absolutely where you can also contract the virus, whether you're touching doorknobs or wherever someone who's been infected has touched. You touch it, and then people keep, whether they're just scratching their face or they bite on their fingernail, they don't think about it, but that's where it is. So by keeping your hands as clean as possible, constantly washing your hands, as well as wearing a mask while you're out, that's your best bet not to contract the virus.
Well, thanks, Dr. Saphier. That is Dr. Nicole Saphier, and I am John Cummings. I'm your host of this town hall on the coronavirus. I'm running for Congress in the 14th District against Alexandria Ocasio-Cortez this November. Remember, please press 0, and we'll get you into the queue so you can ask your question. And we have Kamlesh from the Bronx who has a question about his son. Hi, Kamlesh. How are you today?
Hello?
Hello. You're on,
yes.
You're on with Dr. Saphier.
Yes. Okay. I have a question, like they said, that we should not touch our face when we even come home. But when my son go for shopping, he has gloves. And when he comes home, he take out his glove and throw it in a garbage and took his clothes down in the basement, put it in a washing machine, and then he go take a hot water shower. He does everything, but still he sneezes sometimes. So I am just scared that I should get him tested.
Okay, well, most people are sneezing right now because of seasonal allergies. And we do have to remember that 'tis the season for allergies. So if he is someone who has had allergies in the past, then his sneezing right now is probably from his allergies. But that being said, if he has, you can always just assume maybe he has the virus. If he has any other symptoms, such as a fever or anything other than what would be normal for his allergies, then, getting tested is not unreasonable. But, my first question is, does he have allergies? Because people who have allergies, they tend to know their body better than anyone else. They know if it seems like their normal allergies or not.
Okay. We'll move along to our next question. Valerie in the Bronx has a question, and she had the coronavirus. Hi, Valerie. How are you today?
Hi, I'm okay. I don't know how okay I am. I already went through the COVID-19. I got sick on April 9th, but right now I'm getting better and better. My question is it a good time to take, while I'm recovering, to take immune-boosting supplements, or it will not help my immune system to develop up to the point that is necessary to fight?
Well, a lot of people right now are asking what they can do to improve their immune system. So it's a very valid question. And, the best thing you can do for yourself is to just eat a balanced diet full of fruits and vegetables, and exercise when you can, and get enough sleep, because all those things can actually really do wonders for your immune system. However, especially during this time, as well as vitamin D, by the way, from the sun, you get a very good vitamin to have is being outside and just getting a little bit of sunlight. But there are some immune-boosting supplements, such as vitamin C and zinc and some other things that, some people believe they work really well. Some people don't believe they work really well. But, as long as, you are, under the care of a doctor and they're aware that you're taking supplements, then I don't think it's a bad idea.
Once again, that's Dr. Nicole Saphier, and I am John Cummings. This is a teletown hall about the coronavirus. I am running for Congress in New York District 14 against Alexandria Ocasio-Cortez this November, and we wanted to have this chance to pass along some information to you regarding the coronavirus. And one of the questions that comes up frequently, Dr. Saphier, is this idea of masks. First, we were told one thing, and then we were told the next thing, and then Daniel from Astoria has a question about that. Daniel?
Yeah, hi. Daniel from Astoria. Good afternoon. I was home. I'm an essential worker, not a frontline worker. I work for New York City. I don't want to give it my, my agency, but I work for New York City. My job is considered essential. My question is, how can we be told not to wear masks, don't wear masks, and then we're told to wear masks? Also about the unemployment thing. Why are people getting more money to stay home than go to work? Because I know plenty of people here that are getting unemployment plus the federal bailout, and they're getting more money to stay home, and they don't even want to go back to work. And people like myself on the front lines going to work, dealing with this virus every day.
You can take the medical one, and I'll take the second one.
I was going to say, because I know a lot of people are upset like he is, but so I'll let you handle that second part. But the first part, in terms of the mask, here's the thing, and let's just be honest. We had no idea anything about this virus, and the truth is, in the beginning, we didn't want hoarding of masks because we needed them for our frontline workers. However, we also did not realize how contagious this virus was. We were given wrong information from where the virus started in China. We were given information that it actually wasn't even spread person to person. The World Health Organization, mid-January, put out a report saying that this virus could not be spread person to person. So we really had no idea. It's quite interesting that President Trump actually still did the travel ban, which really did help in the beginning. Unfortunately, because of misinformation, stricter measures weren't continued out. And so had we known then the information we know now, we may have considered wearing masks back then. But unfortunately, this is it's called a novel coronavirus because it's new. We didn't know about it, and we were given wrong information about it. And unfortunately, you can only do as well as the information provided.
Yeah, and as far as the unemployment, et cetera, and people staying home and making more than they would be making if they were at work, that was actually brought up before this legislation was passed. I know that Senator Tim Scott and also Senator Lindsey Graham, both from South Carolina, mentioned that was a possibility, especially in areas outside New York where you don't have a $15 minimum wage. That would certainly be the case. So it was brought up. And the reason that they pushed it through without it is many people, in particular on the Democrat side, I tell you, I try to stay out of politics, but particularly on the Democrat side, say, well, a few people might do that, but don't worry about it. Well, I think it's gone a little bit further than that. I think one of the ways that you could possibly fix that, and I know that President Trump had talked about this, is if they suspended the payroll tax. I know that was an idea that was floated by a couple of people on the Republican side of the aisle. I know the president was in favor of that. And what that would do was it would actually be like a tax cut for people. You'd see more in your check. If you know about the payroll tax, it's about 15.5%. Your employer pays half and you pay half, and you don't even see that you pay it. So it would give you an automatic boost to your check. So perhaps it would make a bit of a difference for you going back to work, that little bit of a difference might encourage people to go back to work rather than sit at home and take the money from unemployment and possibly make more by staying at home. So hopefully they'll work that out. Once again, my name is John Cummings. I'm running for Congress in District 14 against Congresswoman Alexandria Ocasio-Cortez. This is our teletown hall. I'm joined by Dr. Nicole Saphier, who is the Director of Oncologic and Breast Imaging at Memorial Sloan Kettering Monmouth, and we're hoping to hear from Mr. Tom Grech, who is the President of the Queens Chamber of Commerce. We're taking questions about the coronavirus and how it affects people medically, and obviously the sociological implications, and also going to take some business questions as well. And currently we have Jose on the line. Jose.
Hello, Mr. Cummings.
Jose, how are you? Jose is a former student of mine dialing in. How's everything?
It's great. I'm grateful to be back home. I just got out of the Army, and I'm finally back home.
Well, thank you for your service, Jose, as always. Thank you so much. You can have a question for Dr. Saphier or for me. I know you asked me a lot of questions in the classroom, but...
I did. The question is for you, Mr. Cummings. I wanted to know where you stand on the Second Amendment and how basically the gun laws here in New York City are borderline unconstitutional. and make it nearly impossible for the average day citizen to be able to defend themselves, even for basis that the Second Amendment shall not be infringed. And I wanted to know where you stand on that.
I think it's a great question, Jose, and stay safe, please. You know, I think that, I guess not surprisingly, that this has become more of an issue now than it has before, because I think people in their homes are a little bit intimidated now that they're actually there. And I don't think they feel as safe, and it's kind of rather ironic that you don't feel as safe in your own home as you would when you're regularly outside. But I think people, when they sit around and they realize that they don't have much of a line of defense, that this question is actually getting asked. I'm a strong supporter of the Second Amendment. I think in many ways that the restrictions in New York City are too strict. And what happens is you have people who are law-abiding citizens that can't arm themselves, and the only people that end up with guns, for the most case, are people who are in law enforcement that work for the government, and you have some people who own businesses, but other than that, really not a lot of people who get that permit. It's a difficult situation. Like I said, I think it's become much more apparent to people now that they have time to sit and think about it, and I think people's views might change on that as we move along and come out of this coronavirus crisis. It's a very difficult situation. Obviously, all over the country, it's always an issue that's argued from both sides. But I think people's opinions might start to change coming out of this situation in New York City. And Jose, like I said, stay safe. Thanks for your service, and good to hear from you.
Can I just ask one quick question on that one? I wanted to see if actually, you know what? I forgot the question.
All right. Well, it's good to hear from you, Jose. Thanks. Stay safe, and once again, thank you for your service. Jose was a student of mine several years ago, did a couple of tours in the United States Army, and we thank him for his service. We have a question from Francis out in Woodside for Dr. Nicole Saphier. Francis, how are you today?
I'm doing pretty good. How are you?
I'm well, thank you. You have a question for Dr. Saphier?
Dr. Saphier, would it be dangerous at this time to take a plane from New York to Florida?
Well, being dangerous is one question. You know, we're trying to look at risk, and what is our risk? So, no, I mean, flying to Florida in itself is not dangerous, but there are ways to actually decrease your risk of getting an infection. So, one, you want to consider your risk level. If you are over the age of 60, chronic medical conditions such as heart disease, lung disease, you really want to look at what are you risking to actually, essentially be leaving your home. And the truth is, you're more likely to actually contract the virus either in the process of getting on the airplane or the process of being off of the airplane. The airplane itself is equipped with HEPA filters, which really circulate the air. But there are certain things that you can do to also decrease your risk, and that is, wearing a mask, making sure you are social distancing, not standing so close to people, not utilizing, if you sit down, wipe down the area, try to limit how much you touch that someone else has just touched. But the most important thing is to try and keep at least 6 feet between you and the next person, and that can be really hard to do, especially when you're trying to travel, which is why a mask is of such benefit.
That's Dr. Nicole Saphier. My name is John Cummings, and I'm running for Congress in District 14, New York District 14, against Alexandria Ocasio-Cortez, and we are joined by Thomas J. Grech. Tom Grech is the president of the Queens Chamber of Commerce. Tom, thanks for joining us today.
John and Doctor, thank you so much for the honor. It's a pleasure to be here.
All right, we have a question for you, Tom. It's a business question from Diane on City Island. Hi, Diane. Welcome to our Teletown Hall.
Yes, hi, thank you. It's a pleasure to be here. How are you?
I'm well, thank you.
Great, thank you. Sorry.
Good. Okay, my question is, I'm home from work right now, and usually I'm a property administrator in a commercial management office in New York City, and they're telling me that I'm considered essential, and I have gotten a doctor's note because I have asthma, and I'm actually over 60. And I'm not being paid at the moment. So I was just wondering, is that something that should be happening, or is that against the law right now?
So again, this is Tom Grech from the Queens Chamber of Commerce. A fair question, a good question. You're from City Island, right?
Correct. Yes.
I'm a big fan of the crab shanty. I go there all the time. So semi.
You try the fried shrimp?
Yes. No. I'm a broiled shrimp kind of a guy, but nonetheless.
Okay.
So the challenges you face are not unique, right? A lot of folks, it's funny, the government gave an extra $600 a week to people that are on unemployment, and that's also become a double-edged sword because, believe it or not, a lot of organizations, and maybe yours falls into this category, are trying to hire people. But if you're making your basic unemployment payment and another $2,400 a month, you might not be shocked to find out that people are saying thanks, but no thanks. I know people that are trying to hire in the food service industry, the healthcare industry, people that work at a CVS or a Target, as well as in the security field that cannot find people right now. That's a different topic than what we talked about with you, but I just think that you might want to call SBS, which is Small Business Services for the City of New York. You might want to get some complimentary or free legal advice on that score, because if you're not getting paid and you're being asked to go to work and you've got a pre-existing condition with asthma, you might want to rethink that situation.
All right, thanks, Tom. Tom, I would imagine you've had tremendous challenges out there in Queens. Anything you'd like to say to the business owners out there?
Yeah, I'm hanging there. Hanging there. I was on a call with the Queens City Council delegation, 13 strong, talking about the things that we need City Council to do to make things easier, not harder, for small businesses throughout the city. And I was quoted as saying that upwards of maybe 50% of our 6,000 restaurants may never open again. That's a staggering number, but that's the bad news. The good news is we're diverse. We're hard scrabble in Queens. We don't quit. We don't surrender. We've gone through things as difficult, maybe never as difficult as this exactly, but we've got to be resilient. You got to think positive, and we got to fight for what's ours when it comes to the Triple P. They closed now. The EIDL program is now shut down. Queens got a very small percentage of that, and so it's really important that we have our voices heard.
I'm John Cummings. That's Tom Grech. He is the president of the Queens Chamber of Commerce, and we are also joined by Dr. Nicole Saphier. This is today's Teletown Hall on the coronavirus. As most of you probably know, I'm running for Congress against Alexandria Ocasio-Cortez in District 14. And Ty from the Bronx has a question. Hey, good afternoon.
Hi. Well, I have a couple of questions for Dr. Saphier. The first one is, we have the test against the COVID-19, but if the person turned out negative, is it still, does it still mean that the person is still in the dormant state or already out of, the wood?
Well, that's a good question, and there are a couple of tests out there right now. There's the one test that's actually looking for the presence of the virus. That's that nasal swab we've been talking about. And then there's also the antibody test, which is getting a little bit more attention these days, and that's a blood test. So for the nasal test, that's looking for an active infection. So when people have symptoms, a fever, a cough, or you have it, they do the nasal test to see if the virus is there. Sometimes that nasal test can say negative, and that doesn't mean, and unfortunately, that doesn't mean 100% that you don't have COVID-19, because the test is not 100% foolproof. But it also means that it could be another viral infection. We still have some cases of the flu, as well as other random viruses just circulating. Now, the antibody test, if you do the antibody test, and it shows that you have antibodies in your blood, that means that you were already exposed to the viral infection, the virus, whether you knew it or not. Now, some people think that if you have those antibodies, that means you can't get infected again. And we really hope that's the case. But we're not entirely sure that's true. So we have to be very cautious when opening up just based on that antibody test.
All right, thank you, Dr. Saphier. George in the Bronx has a question about unemployment. I'm sure Tom can answer that. George, how are you today?
Hi, good afternoon, Mr. John Cummings. I'm doing well, thank you.
Thanks for joining us.
Yes, thank you so much for hosting this Teletown Hall. Basically, my question is about unemployment services. I've been applying for unemployment here in the Bronx for about a month or so, and I just wanted to know, in general, what is being done to improve services for people to apply for unemployment? As you may be very aware, the Department of Labor in New York is receiving millions of calls, and so people call the Department of Labor, and lines are busy, websites are often not working. So I wouldn't want to go into too much detail about my specific situation, but I want to know in general what is being done to improve the unemployment services for people in New York.
So I'm happy to answer that question, and let me just first say I'm sorry. This was not your fault. This was not the fault of your employer or anybody, but I'm sorry for your situation. Kind of good news and good news, if I may say. As much as it stinks to not get the benefits timely, the good news is the state has already announced from whenever your time ended on the payroll, you will be retroactively compensated back to when you first lost your position. So that's good news. Okay. The other good news is that the state, because the system is older and didn't have the attention that it needed, nor did they expect the huge amount of volume, was helped and sent to the rescue by Google. Google apparently jumped in and helped streamline the operation and helped avoid having you do a verbal call-in to get confirmation of your claim. So that was a huge problem the first 3 to 4 weeks. You know, the system, I don't know how it worked exactly, but the system required you to call in to a human to verify the information. There just wasn't enough humans employed on the insurance side. So help is coming. Be patient and make sure you document whatever you have. Is my best advice for you.
Oh, great stuff, Tom. Thank you so much. Colleen from the Bronx has a call about the virus itself for Dr. Saphier. How are you, Colleen?
Hi. I think she actually, when they were talking to me in the queue, you might have just answered my question. My question was, once you've had the virus, which my husband had the virus, and how susceptible are you catching it again? I mean, he's like an essential worker. He's going to have to go back to work. He has COPD. He already had the virus. I mean, what's the odds of him getting it again?
We don't know, and I hate having that be the answer, but that is the honest-to-goodness truth. I could start spitting out certain studies and best guesstimates, but the truth is we don't know. There have been case reports in South Korea and China about people being infected a second time, but it wasn't clear whether they had been exposed to the virus again or if the virus was actually still in their system and it reactivated. We're not going to have that information, unfortunately, for a bit longer, probably a couple more months. However, based on the limited research the United States has, they believe if you have the antibodies, then and you've recovered, essentially, that means you probably are not going to get infected again. But the bottom line is we don't really know.
Thank you so much for that question. Nassim in the Bronx has a question about testing. Good afternoon, Nassim. How are you?
Yes. My question is, good afternoon. How are you guys?
I'm well,
I hope you guys be safe. Thank you for doing this for everybody. My question is that I called my doctor this morning and asked if she have the COVID test. So he said that they give the immune system test. So do you think I should go take that or wait for the COVID test?
I'm sorry, I'm not understanding your question. Are you talking about the antibody? You're asking about the antibody test versus the nasal swab?
Right. Yeah.
Well, so I guess, are you having symptoms right now?
No. I'm fine. I'm at home. I am.
Okay. Well, then you certainly don't need to go get the nasal swab. But if you're wanting to know if you have the antibodies and you potentially could be immune to future infections, then yes, you can absolutely you can go and try and get an antibody testing. They're not widely available right now, so you may not be able to. But, best thing to do is call your primary care doctor and see what they think.
Well, thank you so much. We have another question from Rose in the Bronx. Rose, good afternoon. How you doing?
Hi, John. Hello.
Hi, Rose. How are you, Rose? Good afternoon.
Hi, John. Oh, fine. It's such a pleasure to speak to you and an honor to speak to you. I taught across the street from St. Raymond's at 127 for 33 years, so we have something in common.
Well, God bless.
My
Good
question,
to hear from you.
God bless you. I'm so happy to hear you running, and I have been following you all along. My comment is first on the problems that we're having in the New York City subways. I was so shocked that they weren't closed immediately because of the conditions there. And now that the government has realized that there are homeless living there, and possibly, infecting the healthcare workers, I was thinking they're not using school buses today since the schools are closed. How advisable or is it practical to think that they could use these school buses in the city exclusively for healthcare workers, which, should be free for them? And this way, these buses can be disinfected immediately throughout the day. They can, spread them out around the city and have certain pickup points for healthcare workers. I don't see why the healthcare people have to go on the subway at all, given the dire situation that we have today. That's my suggestion or my question for you. For Dr. Saphier, who I follow all the time on Fox, I wanted to just know, is it advisable, when should we be wiping down packages, that we receive from Amazon, etc. I've been using regular alcohol to wipe down these parcels. And what about fruits and vegetables? Should we be washing them at all at this time?
Well, all good questions. And, my answers kind of changed over the last couple of months. Mainly, I just essentially tell people what I'm personally doing. And I don't think there's really a right or wrong answer. Because we know that the virus lives on inanimate objects, such as cardboard from your Amazon box. Is it possible that there's virus on that box? It's possible. Is it likely that you can actually get infected from that box? It is highly unlikely, but it is possible because we've seen studies that have shown that the virus can live on cardboard for up to a couple of days, actually. And so what I have been doing is when a package gets delivered, I let it sit for about 24 hours, and then I open it up, I take the stuff out, I throw the box away, and then I wipe down anything that the box has touched. Again, because you want to keep your environment clean. You don't necessarily want to be wasting alcohol and disinfectant on wiping down a cardboard box. You want to save it for your own home space. And of course, you want to continuously be washing your hands. That's the most important thing, is just to be washing your hands. But it is highly unlikely that you will get infected from touching the box. But because we know that the virus can live on there, if you want to keep yourself and your home clean, you just make sure you clean anything it's come into contact with.
And Rose, as far as your idea about the school buses, I really think that's a great idea. Perhaps they could find some centrally located areas or hubs, if you will, where people could pick up that particular bus and head into certain hospitals. I know that people that work in hospitals, and I'm sure Dr. Saphier could attest to this, it's really difficult for some people to get to work. Driving in, et cetera, it can be difficult. Some people take mass transportation. They're going to be closing it down, my understanding, overnight between 1 and 5 a.m. now. So maybe they could get some school buses that could be centrally located and drive people to various locations. Okay, we have time for one more question. We'll go to Eileen in the Bronx. Hi, Eileen. How you doing today? Hello, Eileen.
Hello, Mr. Cummings. It's a pleasure to meet you over the phone. I'm wondering, I'm supposed to have an eye doctor appointment. One group of doctors won't open until there's a go-ahead, but there is a doctor that will see me. And how safe am I at this time to see the eye doctor? In other words, they did say they were distancing and not having too many patients and distancing them. And also I'm wondering about, I may have to get eye drops. concerns. It seems like it might be an urgent, otherwise I would wait. And the other question, well, like what kind of mask is the best, and eventually will everybody get tested? Sort of three-part question. Thank you very much.
Okay.
Okay.
Well, so those are all very valid questions. And when it comes to, it's not just COVID-19. We all still have other medical issues. We all still have, high blood pressure and diabetes and even cancer that needs to still be addressed. And so if there is an eye issue that is potentially urgent or causing discomfort, you absolutely want to go see your doctor. And you want to make sure you're doing it safely. Now, when it comes to the eyes, you can actually contract the virus by touching your eyes, which is why we tell people not to touch their eyes. But if you're keeping your eye drops clean, you're doing a good job of not touching your eyes and your hand washing, then that's smart. Now, in terms of where you actually go out to the doctor, yes, anytime you're going to be leaving the safety of your home, you are increasing risk of having some sort of social interaction. And, there's viruses circulating. And so what can you do to stay healthy? Wear a mask at this time when you're out in public. If you're not able to be 6 feet away from people, you make sure you have an appointment, call ahead of time. They probably have changed things right now and have some new formats of how they're handling their waiting room. But you want to make sure that you are taking care of yourself and not neglecting certain things because you're so afraid of COVID, because at the end of the day, there are far worse things out there, such as delaying care for certain illnesses that would be much worse than catching the virus itself.
Well, that wraps it up for us here today on our Teletown Hall. And if you are on the line and you'd like to leave a voicemail, you will immediately be transferred to that voicemail. You can leave your questions, and we'll get back to you. And I'd like to thank our guest, first of all, Tom Grech, the president and CEO of the Queens Chamber of Commerce, for jumping in for a bit, and for Dr. Nicole Saphier, who just did a tremendous job for us here this afternoon, helping everybody out as they're trying to get information about the coronavirus. And once again, I'm John Cummings. I'm running for Congress against Alexandria Ocasio-Cortez in District 14. And hopefully, to be quite honest, hopefully we'd like not to do this again, but if the situation necessitates, perhaps we'll do this one more time as this progresses. Once again, Dr. Saphier, thank you so much for joining us today.
Thank you very much for having me. This is my pleasure.
Once again, if you're still on the line, please hang on there. You can leave a voicemail. We'll get back to you. Thank you so much for joining us. If you want to find out any more information about everything we just spoke about or about my campaign, please visit our website at Cummings2020.com. That's Cummings2020.com. Thank you, everyone. Be safe. God bless you, and have a great afternoon.